Welcome everybody. Thank you all for coming this morning. There's a good collection of you. And Jane's got some really exciting work to share with you, I think. Before we get started, I just want to do a little bit of housekeeping and say that if you could stay on mute throughout the session, that would be really helpful if you can. If you come off mute, I might mute you if there's background noise, just so everybody can still hear what's going on. It's not because we don't want to hear from you and I don't want you to be offended.
I was going to say that.
Oh, well, you're always getting in with my housekeeping, Corinda. So yeah, it would be good if you can stay on mute. That would be really helpful. If you want to put questions in the chat, I can kind of keep an eye on them as we go along and flag them to Jane, but we're going to try and do most of the questions at the end. There is some time for us to do that. Or you can raise your hand by going into reactions. I think it's in there now. And we'll keep an eye on that too. If you don't want your face to be in the recording, it would be good if you could knock the camera off, because I can't dictate which people end up being in the recording. And I will send that recording out to everybody after the session today. I think that's all I've got to say. And so I'll hand over to Jane.
Thank you, Rachel. Good morning, everyone. It's fabulous to see you. Thank you for joining us. First, a little bit of an apology. I'm really sorry that Veronica Malenga from Seeability is not able to join me to co-present this morning. She emailed me this morning to say that she's not feeling very well. So I hope she gets better soon. But I will try and do my best to represent Veronica's slides and Seeability when we get to that bit. So today we're focusing on helping people with learning disabilities to use technology in the ways that we want. And Veronica and I worked together on this for a number of reasons. It all started, you won't be surprised, last year during the pandemic, when pretty much all of us realised that technology was really important for helping people with learning disabilities to stay connected with their family, with their friends, with their services. And we learned a lot around what it takes to kind of support people. And we found out about some really exciting and creative practices, some of which you will have been developing, some of you on the call. Early this year, Veronica and I got together and we thought, look, we've learned so much. Wouldn't it be great if we could share that so that we can help develop support practice further, even after the pandemic? We want to learn from the pandemic, but we kind of think that what we've learned could help people afterwards. It's not just a pandemic specific thing. So that's our motivation, really. And what we learned in the pandemic that we think applies to life generally, whether we're fighting COVID or not, is that being able to use technology is really important for everyone, but it's particularly important for people with learning disabilities, people with lived experience, because it helps them keep connected. And if they're connected, they stay well, physically and mentally. So we learn a lot around how being able to talk to family and friends online with Zoom and WhatsApp and Facebook and others really help people's well-being and their mental health as much as anything. We also learn, things like Zoom and how creative lots of services were about creating things like Zoom quizzes and Zoom karaoke and all kinds of things that technology can really help us stay active and not get bored. And that can be important for all kinds of reasons. But also technology helps us keep in contact with services like the GP, like our social workers, support workers and others. And that can be important for us. But probably that bottom bullet point is the most important, is that, if we can use technology, then we can do what everybody else does. And that's really important. Anybody we meet, we talk to, you just see how important technology is in their lives. So why shouldn't we be any different? So just to say a little bit more about the toolkits, who designed them. So it was a collaborative exercise designed together with partners. So it involved me. I didn't explain, actually, I'm from the Open University, sorry for that. It involved Veronica Malenga from Seeability. Many of you know Seeability is a member of Learning Disability England. And members with lived experience within Seeability. But also Seeability and other Learning Disability England partners, organisations were part of a Creating Connections project last year that was funded with COVID funding to help service users, people with lived experience, stay connected. That wasn't just about technology, but technology was a key part of it. So we worked with members of the Creating Connections community as well. And that involved meetings where we'd share ideas and members would give feedback about what worked, what didn't, what was important to them, as well as trialing and telling us whether things worked and so on. So a real partnership. So what we've designed is 3 toolkits for 3 different groups of people or stakeholders. And I'll tell you a little bit about why we've designed them like this. So the most obvious one to kind of design is that middle one, number 2, designing a toolkit for those who support people with learning disabilities. And that's where most of the time we focus. We always talk about, oh, we need better support. We need to train support workers. By support workers, we were thinking very generally about parents, about carers, about people in residential homes, about college lecturers, service providers, anybody who has a formal or an informal role in supporting somebody with a learning disability to live the life they want to live. And so it kind of made sense to build a toolkit for them. And I'll tell you more in a sec, but that was to kind of offer them ideas and suggestions to see what was possible, and it's not as hard as they might think. But we really didn't want to set up the impression that good support relies solely on support workers. We wanted to make it absolutely clear that good support is about good management and good funding of support services as well. So we designed a toolkit for what we're calling managers and funders of services, because we wanted to give them advice and guidance, ideas and tips and suggestions that really help them see that they had a responsibility to help their staff, to help support workers, to develop the skills needed to support technology use. And so that's why we developed that 3rd toolkit. We also developed a toolkit for people with learning disabilities. And just to explain that, so politically the message we were wanting to give is not that people with learning disabilities are responsible for support, and if they get bad support to use technology, it's their fault and they need better skills and training to get better support. But in the spirit of, if you like, person-centred care and the person with a learning disability being at the centre of everything, it didn't make sense to leave them out, if you see what I mean. So we developed a toolkit specifically for people with learning disabilities, and the idea was that we wanted the toolkit to help them start conversations around the kind of support they wanted with their support workers and others, and that it would be something to help them think through, do I want to use technology? If so, how would I like to use it, and what kind of support would I like? So that's the kind of philosophy or politics behind that toolkit. And we designed the toolkit so they all speak to one another, so there'll be reference to one toolkit and another toolkit. They can be read together as all 3, or they can be read separately and used separately, but they do talk to one another, if that makes sense. So just to explain a little bit more about supporters, when you use labels, we all know in this community, labels are really difficult. They don't, sometimes they're meaningful to people and sometimes they're not. But in the context of the toolkits, when we're talking about supporters or support workers, as I've tried to explain, we had a really big, broad understanding of that. So carers, advocates, self-advocacy organisations, people who work for learning disability charities, people who work for services, could be parents, siblings, day service providers, health and social care providers. And a lot of the advice in the toolkits comes from experience from the Creating Connections project, but also evidence that I collected during some research that I did last year, where I interviewed over 30 support workers, and they covered the whole range from parents and siblings all the way through to college lecturers, occupational therapists, etc. So the resources, if you like, link to those interviews and really add authenticity to the guidance that we're giving. One of the things we did with the toolkits is to think about what kind of things are we trying to develop in practice? And when we talk about training and we talk about developing good practice, we often talk about skills or competencies. What do support workers need in order to do their job? So we thought about that and we created a framework to kind of explain our conclusions, if you like. And the important thing to share with you is that we concluded that good practice in this field is built on not just knowledge, but also beliefs, what we believe about certain things. And that if we're going to help capacity build and develop good practice in that field, we don't just need to focus on what people know and what they can do, we need to focus on what they believe as well. So that's what our toolkits try to do. So in order for you to understand the structure of the toolkits, I'm just going to take you through the framework in a bit more detail. So we came up with a set of 5 core beliefs that we think are really important, that underpin good support in anything we do, but particularly in relation to technology. And so the first core belief is, if you like, that it's really important that those who are in a support role believe that it is part of their role, part of their job to help people with learning disabilities use technology. What quite a lot of us have experienced, particularly during the pandemic, is occasions where we've tried to talk to support workers or staff in care homes and say, can you help John, just get on Zoom to talk to his mum or whatever? And the support worker says, not my job. I'm here to help them get dressed or to feed them. Technology is not my job. And the Creating Connections communities and the people that I interviewed as part of my study felt really strongly that actually, yeah, it is part of our job. Can't really ignore it. So we felt that was an important belief. Another important belief was around believing that with the right support, people with learning disabilities can use technology successfully. Sometimes, not all the time, sometimes we came across support workers or support organisations who kind of write people with learning disabilities off and say, oh, they can't use technologies, they don't know how to use it, there's no point even trying to help them. And so we feel it's important to kind of knock that on the head and say, no, actually, they can with the right support. The next set of beliefs are all kind of interconnected and overlap, but it's probably important to separate them out. And in this community, there'll be no surprise to you, but it is still important to, if you like, speak about it. So the third belief was around belief that people with learning disabilities should be supported to make informed decisions around using technology. Sometimes that decision might be, I want to use Zoom or I want to use a tablet. Sometimes the decision might be, actually, I'm not interested in technology. And that's fine, as long as it's an informed decision, if you like, and that they've not been coerced into making that decision just to make people's life easy. The other thing, and it really does link into the pandemic, I think, is a belief that people with learning disabilities have a right to use technology if they want to. Quite a few people in my study, and if you talk to people, you hear people talk about, well, it's a human right now, you know, to be able to access technology, get on the internet. It's just a human right. Everybody can do it. Why can't we? We need it to be able to live our lives. And then that fifth core belief is around person-centered support. That, you know, if we're supporting people to use technology, it needs to be adapted and customized to meet the needs of that person and not a one-size-fits-all. So those are the core beliefs, and I hope they make sense to you. I'm sure they do. That we feel really needed to be reflected in the toolkit. And probably no surprise, but maybe the bits in this bit of the framework might be a little bit of a surprise, because what we did with knowledge and understanding is to kind of think outside the box a bit. So typically when we talk about training around technology, people often go to the ICT skills bit. Oh, people need to know how to use a laptop, how to get into Zoom and stuff like that, the technical stuff, if you like, and of course they do. But we didn't want our toolkits or our framework to just talk about ICT competencies, because we felt that development opportunities and training opportunities needed more than that. So our framework that the toolkits reflect divided knowledge and understanding into 3 areas. And the first area is actually good support is around understanding the person that you're supporting, understanding their motivations, why they might want to use technology, what kind of support they might need. And part of that is knowing what technologies they could use, having a broad knowledge about what's available and the functions of technology, so that you can kind of give people advice and know why people might want to use something. So technology is in there, but you can see it's more than just the ITC skills, competency stuff. It's understanding the benefits of technologies, the value of it, knowing how to use technologies in the way that people want to use them, but also understanding the typical difficulties that people have so that we can put strategies in place to mediate those difficulties and to get rid of them. The third one, I'm really passionate about. You won't be surprised because I'm a professor of education, but it's about learning. So we feel that good support, particularly good support to use technology, requires us to be able to learn and to be willing to learn continually. Where learning here is understood about problem solving, all of us have experience with technology. No matter how brilliant we are with technology, we all get unexpected problems with technology happens. And part of good support is thinking, okay, I'm not going to panic. I'm just going to kind of problem solve, work through it. And then once I've figured out how to do something, I'll share that. I'll learn from that and remember it for next time. But it's also important to learn from the positives and the negatives, because that feeds into the advice we give people and the support strategies we can put in place, is building on what worked before and what didn't work. And I think that's important, not setting up the assumption that we all know that it's possible to be perfect all the time and at the first go. That, you know, good support is about learning all the time, particularly with technology. So that's the framework, some core beliefs and some areas of knowledge and understanding that go beyond basic kind of ICT competencies. And what we've done is to, in the toolkits, reflect, put stuff in that helps people hit all of those core beliefs and all of those areas of understanding. So for all the toolkits, whether it's for a person with a learning disability, a support worker or a manager, we've structured them so that there's a bit on each core belief and there's a bit on each area of knowledge and understanding. And so for every core belief and every area of knowledge and understanding, We give some suggested actions, and they are suggested actions. We've been very careful not to try and set up this expectation that this is a recipe book, that you step one, step two, do this, do that, do the other, in a particular order, in a particular way. So what we've tried to do is just offer suggestions. It might be useful to think about this. Here's an example that you might like to try, because we don't believe that good support can be prescribed in a way, particularly if we believe in reflective learning. So there's suggested actions, there's case study examples, and they're real case study examples from the interviews that I did with supporters, but also from the Creating Connections community, from their practice as well. And online links to helpful resources, and pretty much all of these resources are learning disability specific, and pretty much all of them have been developed either by people with learning disabilities themselves or the organisations that support them, like self-advocacy organisations, for example. So there's stuff in there from ACE Anglia, for example. There's stuff in there from Learning Disability England's website, from Learning Disability Wales, all kinds of useful stuff that's produced by people with learning disabilities, sharing their experiences. Sometimes it's video clips, sometimes it's easy read guides, but it's all real stuff based in real experience. And then for every core belief and area of knowledge and understanding, there's a planning and evaluation tool as well. So just to give you an example of what the toolkit looks like, so here's an example around one of the core beliefs around believing that support is effective if supporters believe that it's part of their role. So you can see we describe the belief, we give some suggested actions, so and then we give a case study example. Then we give some resources, and there's always an interactive online link to click onto to follow those resources, and a planning and evaluation tool. And again, this is an interactive PDF, so people can click straight into the PDF and click on it and type in stuff and so on. So here's an opportunity where we're asking people, for this core belief, what are you currently doing? How well do you think you're doing it? So that's where you're encouraged to kind of go, brilliant, yeah, so, or not very well. And what can you do to improve what you're doing in this area? And again, there's no prescription, there's no right or wrong answer. It's just an opportunity for people to kind of think about what they've seen in the toolkit and think, okay, well, I'm doing that, but I'm not doing that. And maybe I could have a go at this, and then just record it if that's helpful for them. So Veronica and I have been sharing the toolkits with Seeability staff and with the wider Creating Connections community, and we've been doing some piloting work and some evaluation work. And through that, we've learned, if you like, got some ideas about how best to advise people to use the toolkits. So each toolkit is 30, 40 pages, which kind of feels I know it feels a bit big, but it's not meant to be something that you kind of sit down and read all in one go and then think, oh God, I've got to remember all that. It's kind of something to be kind of going back to and using as a stimulus over a period of time. So some of the kind of advice I've given to organisations and colleagues is to, well, you know, have a read through it, and then maybe there's something there that you think, actually, that's what I need to be focusing on at the moment, so do that. So it might be a core belief, it might be one of the areas of knowledge and understanding. You think, actually, we're doing all that, but this bit here we're not doing so well, let's just focus on that. Think about what you're currently doing and what do you think you could do to expand or strengthen that. And sometimes it can be helpful, particularly for a support worker, if they perhaps choose somebody they're working with at the moment, have that person in mind when they're looking through the toolkit and focus on that person and think, okay, for Jane, I'm working with them at the moment, what could I do to help Jane? And again, that might be about prioritising particular core beliefs or areas of knowledge, but just this idea that, that you can just focus in on one activity, one belief, or one person, one service, one home, whatever's helpful. The toolkits, I think, could be useful as kind of a sharing resource where there's lots of case studies, lots of resources, and I think it would be really helpful. It could be a way, if you like, saying, oh, have you seen this case study where such and such did such and such? Do you think we could do that? Almost something you chat about in a staff meeting or over a cup of coffee, just to kind of trigger thinking about what's possible, why something might be important, what the potential difficulties or solutions might be, just to trigger those thoughts and those discussions. Sometimes when we were trialing, what some people have done is to have, if you like, a little project. Okay, this toolkit will help us do a little kind of short-term 4-week or 8-week project where we focus on something in particular. Maybe something, a theme or an objective that's a care home has decided they wanted to look at, for example. So it might be that you can use this to support a project initiative. So it could be that you're working with a group of people and you say, okay, let's use this tool to figure out, what you want to do within your home to move things forward. And because of the planning and evaluation tool, it might, and the kind of prompt to reflect and record things, it might be, particularly if you're doing a project, that you can use a toolkit to kind of collect evidence, collect stories, collect experiences that you can feed into discussions with managers or meetings and so on, around what you've learned about what works, what doesn't work, or about what's important. So just some ideas that I've shared with others. So for example, in the toolkit, as I've said, there are loads of links. So here's an example. There's links here around person-centered planning tools. So there's a range of tools that we found that we put in the toolkit. And so a little project could be where you get a group of people together, staff and or people with learning disabilities, and you say, why don't we just work through all of these? Let's go and have a look at the multi-me tool. Let's go and look at what Shane's mum said. Let's look at the Book of You. Let's look at this Insight app. Let's go and look at the Book Creator app. And, let's do a little, almost like little research study where we look at all of these and we evaluate them and figure out which one might be best for Jane or might be best for our home. And that's what I mean about kind of like triggering a little bit of a kind of investigational project. And then you might then think, okay, we've had a look at all of these and we actually really like this one. Let's go and make a recommendation to our manager that we get this one or that we explore this one in a bit more detail. Another kind of project that you might want to do that would really be collaborative and involve staff and people with learning disabilities is, for example, evaluating how useful some of the guides are. So what we put in the toolkit in various places is lots of guides that we found to use in technology. Quite a lot of them are easy read, various different versions of what easy read means, but they're guides designed for people with learning disabilities and or their support workers. So a little project could be to have a look at all the guides and see which ones are helpful, or even, okay, how could you improve on them? Okay, this guide's a start, but it doesn't do this, so why don't we just adapt it and do something for our home that builds on this, and whatever. So that's what I mean, again, about just triggering thoughts about, okay, here's a start, how useful is it, how could we build on it? And there's lots of video clips in the toolkits of people with learning disabilities talking about why technology is important to them, the different ways they use technologies. So the bottom one, for example, Becoming Visible, is about two guys, Ian and Corey, who use Zoom and YouTube to share their dance performances, really creative, and something that's really important to them. So again, it might be that a project is around looking at all the YouTube clips, sharing those with the people that we're supporting and saying, look, Ian and Corey are doing this. Do you fancy doing it? Could we do something different? Just triggering those conversations about, yeah, actually, I don't like dance, but I love, I don't know, something else. I can't think, my brain's gone, but you know what I mean. So yeah. triggering those discussions, basically. So Rachel was telling me that there's quite a variety of people here on this call who are in different roles, but just in case we've got managers and kind of supervisors, people who support staff and in some way support staff. And if you're interested in using the toolkits, brilliant. But a bit of advice is to avoid the temptation to download the toolkits and then give it to your most technology confident person. And so here, try this toolkit. That's probably not going to be the best use of the toolkit. And one bit of advice I would suggest is what you might like to do is to set up a buddy system whereby you pair up somebody that's more confident or very confident in using technology within your organisation with somebody who's perhaps a bit less experienced or less confident. I'm trying not to use pejorative labels, but hopefully you see what I'm getting at. Pair two people up together when they can support one another and use the toolkit together. Because it's really hard to have a conversation on your own. So I've said that the toolkit's meant to trigger conversations. So don't just give it to one person and say, here you go, use it. It's probably best used in groups where people can kind of bounce off one another in terms of ideas. But also think about how you can use toolkits in combination with a range of other things that are available. So for example, there is other kind of technology type training and advice available, AbilityNet, for example. So it might be that you set up a development program within your organisation and the toolkits is just one part of it. And the other part is, right, I'll talk to AbilityNet or some other organisation about getting the accessibility / tech stuff sorted as well. So if Veronica was here, she would tell you a bit more authentically about how Seeability have used them. So quickly this morning, I just came up with what I know about how Seeability have used them. And I'm sure if you want to contact Veronica outside of the meeting to find out more, she'd be delighted. But Seeability have really got the bit between their teeth and are really moving with their digital inclusion agenda, which Veronica leads. So Veronica's vision that she's working on is getting all the staff in their homes and services to support people with lived experience to use technology. So her vision is to get the toolkits into all the homes and all the services. And with me, I've supported them to pilot the toolkit in a number of their services. And Veronica's organised, as I've said, additional ICT and accessibility training. And one of the things we've just done recently is we've recorded an internal training webinar around the toolkits that I ran for Veronica, and Veronica's put that on her internal learning management system, and her intention is that's now going to be used as part of induction for all new staff at Seeability. So hopefully you can see how a big organisation like Seeability have kind of really gone with this and thought, yeah, this is important. But also hopefully you can see that they're not putting everything on the toolkits. The toolkits are just part of a whole strategy. But the toolkits are, if you like, are supporting Veronica and Seeability in thinking through what they'd like to do with the people that they support. So that's pretty much the end of the presentation. I'm going to leave this slide up, but as I say, Rachel and I will be sharing it outside of this meeting. So if you don't get those links now, there'll be opportunities after the meeting. These toolkits are freely downloadable, either from my OU website, which is the top one, or Seeability have just created a web page where they put all the documents as well, and the link to that is there. Seeability are tweeting about it this week as well, so if you're on Twitter, they've got a link in one of their tweets yesterday if you just want to click on that quite easily, and you'll download them all there. So basically they're free, use them, please do. If you want support to use them, contact me and I'm more than happy to help you think through how you might use it in the groups that you're working with, and I'd be delighted to hear your stories about how well or not they're working. I don't know if the toolkits are going to be the solution to all of our problems, but I'm hoping it's a start, and it might be a start of a 10, and as a community we might build on them, but I think it's an important start. So I'll stop there and allow Rachel to coordinate questions.
Thanks, Jane. That was brilliant. Really helpful, I think. People have asked if I can put the links in the chat. I don't actually have them right now, but I will make sure that they get sent to everyone just after the session. Pat, I think you've had your hand up for quite a while. Do you still have a question?
Do you want to put your mic on, Pat?
Yeah, that's a very good idea. Sorry. Yeah, I couldn't answer you when you put the thing in the chat. I couldn't answer you because I can't access the chat very well. So that's just a bit of information for you. Yeah, I'm wondering whether we're going to get this presentation, and also I'd like to be involved in anything that's going, please.
Hi, Pat. Lovely to see you again. I'd be more than delighted to involve you, and I'll certainly make sure you've got the links to the toolkits and we can have those conversations. Absolutely.
Lovely. Have you got my email address?
No.
I can pass it on.
Brilliant.
Yeah.
I'll do that.
Thank you, Jane.
Thanks, Pat. Corinda, you asked a question earlier in the chat about what was it? Was it, can MPs get involved in this?
Yeah.
Was that what you were asking?
Yeah. So like if MP can get involved in the learning disability, so like if it like government or the MP and get involved.
I think that's a really important question, Corinda, because ultimately, one of the things we probably need to do as a community is to lobby so that people in health and social care roles and positions are supported to develop their practice. And that needs lots of things. It doesn't just need training, it needs kind of new workforce development objectives and so on. And certainly politicians can be involved in trying to move the health and social care agenda on in that way. I have links with a group called Policy Connect, who some of you might know, and they are linked with the all-party parliamentary group on assistive technology. So I will link into Policy Connect and see if they can help us get into policy and talk to MPs that way. Seeability, I know, are interested in lobbying, and I was just telling Rachel, we've just drafting a letter to write to CQC around the need for workforce development in this area, and we've given them, you've told them about the toolkits. So yeah, I think there is something to be done around policy that doesn't necessarily position health and social care providers as the villains, but says, look, you know, they've got an important role to do, they need support to do it, around being more confident to use technology with the people they're supporting, and let's have those conversations.
Thank you. Mel Chapman, I think you were next.
Oh, hi. Yeah, I put my question in the chat. Can you hear me okay? I've got a new,
Yeah.
I've got new headphones and mic that somehow keep throwing me out of the Zoom session. So sorry if I keep vanishing and coming back and if I've missed this. Are there any examples of the toolkit for people learning disabilities being used and how that's worked? And also with managers, because the examples I've seen have been around support workers.
Not yet. I think that's a big area to work on. So in the pilots with Seeability, people with learning disabilities were reading through the toolkits and giving us feedback, but no examples of it actually being used beyond that. So yeah, that's an area that needs more thinking through, and that's where, you know, you guys can help if you like, and Pat and others. One of the things I forgot to say is that we have produced an easy read version of the toolkit, and because Seeability in the name is also around visual impairment, we've produced a large text, no pictures version of the toolkit as well. So I think the toolkit probably can't be used without support, but as I said, I think it would be useful to trigger those conversations, and that's a big step, is just getting more information around how it can be used by people with learning disabilities. So Mel, if you've got ideas, brilliant. I'm happy to talk to you further.
Yeah, I mean, we're part of the Creating Connections project, and we took part in the first phase, and we're taking part in the second phase as well. So using the money to buy some tablets for people we support who didn't have access to them before. So we'll be looking at that, but I didn't know whether there was training provided or whether it was for us to work through one-to-one the toolkit with them, with people in a small group.
I think if you need training, then contact me and Veronica, and we'll work it through. Yeah.
Okay, that's right. Linked with Veronica, so that's great. Thank you.
Thanks, Mel. Michelle?
Hi, sorry. I think I was on off video and mute. I just want to basically say what we've been doing and what we've got on offer to share to people. Myself and my colleague have been running a digital inclusion project since February. We had some local funding, which we've spent on about 30 tablets. We've created a very similar thing to your toolkit, which has got initial assessments around people's motivation, why they would use it, what adaptations they would want, and we wouldn't buy the tablet until we'd done that. So we would be buying them based on people's needs individually rather than bulk buying. So we've worked with about 15 people so far, and we've got lots of case studies, lots of videos. We've had lots of ups and downs and lots of learning from it. So we're really happy to share everything with everyone. We've got a similar toolkit. So it's kind of all the initial assessments with people, everything's an easy read. We've done like a template for 12 sessions, 12 learning sessions, which can be adapted to what people want. We've also got examples of completed ones where people have finished. And with some of those, I've done 19 sessions, and it's got photographs of every step that we've broken down of what that person has done. Some people needed more steps than others. So we've got lots of resources we can share with people. Also, we're working with Sheffield Voices, who have done a similar project, and we're going to host a conference in Sheffield at the end of March next year, and love to invite all of you. So it's just working out how we can link with everyone. And we did speak with Sheffield Voices, asking if we could set up some kind of national or local East Midlands network. So it looks like there are quite a few networks already. So it's just wondering how we can all link up.
I'm sure Rachel's got ideas on the link up front, but Michelle, which organisation are you from?
EMH, Care and Support.
EMH, Care and Support, brilliant. I'd love to see the stuff you've created, and would be absolutely delighted to incorporate it, the links to it in version 2 of the toolkits. This is exactly what we want, is a community sharing resources together to kind of build that capacity. What you've described sounds brilliant. Thank you.
Thank you.
And in terms of sharing the networks, maybe if people have a network that they're open to inviting others to on this call, you could let me know. Then the best email for people to get in touch with and the name of the network, and I can share it with everybody after this. And hopefully that might be the best way. If anyone's got any other ideas, you can let me know. Thanks, Michelle. Sue?
Oh, hi. I was wondering if, as part of the research for this, were you able to establish how many providers of residential support actually provided digital equipment for the people living there?
No,
Or is there any of that around anywhere?
no, Sue, that's a really good question. The research I did was qualitative, so it was interviews with people about their practice rather than a survey of kind of what service providers were providing. We could probably patch together from a range of research a kind of picture. So, for example, I know Chris Hatton and colleagues, as part of their COVID research, have done widespread surveys of people with learning disabilities and support workers, and a bit of that includes digital inclusion, whether people have got access to internet and phones and stuff. But no, there's no study of the one that you've described, and maybe there needs to be. So that's something to think about.
Yes, I mean, I'm thinking about this in relation to a friend who's been in supported residential for a long time, and I've been asking on a friendly basis all that time, you know, is there a computer? Are you doing anything? I don't know if anything's happened in the last 12 months, you know, through COVID there, but I think that that's another area of pressure that perhaps needs to be put on, you know, that and prior to that as well, we did CQC inspections. I supported a self-advocate to do that, and it was astonishing how little digital access there was, you know, in the places that we visited. So I guess that's about getting the providers on board at quite a high level, isn't it, to make sure that's throughout the organisations.
Yeah, and I do think that's something that we should be lobbying about, going back to the politicians and the policy, is around, you know, what does good quality care look like? And if we're inspecting that, you know, then, you know, does the criteria include issues related to technology? We could be fobbed off with, I think there might be criteria around person-centered support, and people might say, well, that technology can be included in that. But I think that might be a bit of a fob off. So certainly in my research, you know, so siblings and parents were telling me how absolutely frustrated they were that the care home that their child or brother or sister was in didn't have Wi-Fi across the whole care home. It was just, you know, in one room, or even that the furniture in their son's bedroom was such that the son couldn't use the technology because, you know, there was no table, or the table was too high and they couldn't put the tablet on, you know, all those kind of things that care, you know, not really being thought through. So I think there is something around inspections that we need to be lobbying around. Absolutely, Sue.
Thanks, Sue. Carl had a kind of related question in the chat earlier about, does CQC grade specifically on people with learning disabilities rights to access technology?
I don't think so.
And I suppose that might link to some of the seeability things that you were talking about earlier, Jane. And Andy asked earlier if this has been related to the Fill in the Gaps research that happened last year.
Yeah, so Filling the Gaps was a sister project, if you like, that was run by Liz Tilley and Jan Walmsley and Lorna Rouse. I did the Keeping Connections project alongside that. So the Filling in the Gaps was talking specifically to self-advocacy groups about what they were doing during the pandemic to support people with learning disabilities. And you won't be surprised that self-advocacy groups were saying, we're filling in the gaps that other service providers are just not doing at the moment by and part of that filling in the gaps was a lot of self-advocacy groups were helping people get access to technology remotely and stuff like that. So I tapped into those interviews and used them in my Keeping Connection stuff. So quite a lot of the evidence that underpins the toolkit is from the filling the gaps side of stuff, so to speak. So I don't know if that was what was motivating the question, but yeah, filling the gaps is in the toolkits, if you like, because I drew on the interviews because I was part of that team.
Great, thank you. There's a couple more questions that have just come into the chat.
Okay. I just want to say that me and Kate and I think some of it, me on a spokesperson, right? Like on the spokespeople.
Yeah.
How will it work for the spokespeople?
How does what work for the spokespeople, Corinda?
Like like for this like toolkit, not a toolkit.
Oh, I wonder if we could maybe talk about that separately.
Yeah.
Because not everyone in this call is a spokesperson for
No.
disability
Yeah.
in general, so maybe we can just talk about that. Is that okay? Just so we get
And
through everyone
also
else's
about
questions.
the people first as well. Like the people first that involved.
So have people first been involved, Jane, in this work?
Some people first groups were part of the research, so their experiences have informed the toolkit, absolutely. But they weren't involved in designing the toolkit, but their stories, some of their stories are in the toolkit, if that makes sense.
Great. Jane asked, are there any nationwide initiatives to create training directly for service users to use technology?
One initiative that I know of is Digital Unite. So some of you might remember the Digital Lifelines project, where the government funded provision of about 5,000 tablets plus data plus some training to people with learning disabilities. And part of that 6-month project was that they gave some money to Digital Unite, who are an online training type company. Digital Unite have worked with MenCat to develop what they call a digital champions kind of online training offer that's specific to learning disabilities. So as part of the Digital Lifelines project, they made this online training available to anybody who was given a tablet who wanted the training. And I'm working with Digital Unite because they're now thinking, okay, the project's finished, but you know, does this digital champion training have a life outside of the project? And Digital Unite, Aspire, that's what it is. Thank you, Michelle. Are really keen to kind of figure out, is there a market, is there a need for this, so to speak? So they're a charity, like pretty much most of us are on the call, so that they're not a government organisation, they're a charity. But that's just one example I know of a kind of a potential to go nationwide with it. I can, outside of this, I can give you more information because my brain's gone a bit blank. But anyway, anybody else got any other suggestions?
Hi, Jane. Hi, it's Patricia Charlesworth here. Why weren't people with learning disabilities on the other bit? Why was that? Is it not important as well?
I'm not unsure I understand the question, Pat.
Well, you were saying that they were involved in their ideas went into the toolkit, yeah. But they weren't part of putting it together. I think that.
So I was saying people first, specifically people first. So people with learning disabilities absolutely were involved in putting it together, but it was people who were part of the Creating Connections team. People with learning disabilities absolutely were involved in thinking through the design of the toolkit. But when I was just specifically talking about saying that about people first.
Yeah. Okay. Thank you, Jane.
Thanks, Pat. Does anybody else have any questions? I can't. There's quite a lot in the chat now, so if I've missed anything,
sorry, can I just say something, please? My name's Wendy Marshall. I'm from Outlook Care. I know it might not be exactly what you're talking about, but regarding technology generically for people with learning disabilities, our company done really well, because once the pandemic opened, we initiated Teams, Microsoft Teams, and we was using that to keep people in contact, and WhatsApp to keep families involved, in contact with their loved ones, for each other, to keep their friends from other services to keep in touch, staff to keep in touch. But the main issue we really found regarding our guys with learning disabilities is cards, payment cards, because so many places we went into, obviously I appreciate the mental capacity of some of our guys, we had to pay everything on card. Some of our guys haven't got the capacity to have a PIN number. They would never ever remember their PIN number. We'd be asking them daily for a new PIN. Count lists or contact lists would be dangerous for some of our guys, because it would just be, they would brush past it and not get the full capacity of it. But a lot of our guys can't do a lot of activities now, because you've got to buy it online, you've got to have a credit card. Some of ours are corporate of protection. They won't let us have pre-cards. They're our biggest issue we've had over the pandemic, to be honest. And I don't know if there's any way, I know there's technology is more to do with computers, but whether there's going to be anything to help the guys regarding that side of things.
Not my area of expertise, but you raised a really important issue, Wendy. And I think that's about us as a community lobbying. And I think through Policy Connect and AppGat, we could have a really good forum for thinking through those issues around payment and affordability. So I know, for example, through the Digital Lifeline project, the issues of cost of data was an issue. So that whole thing around how do you pay, and have you got the money to pay for some of these online services, I think is really important that we need to be lobbying around. Absolutely.
Yes, it's like, even I understand our guys are under court of protection, and I know they've got rules and regulations, but even like something like a prepaid card, so our guys can actually be independent. They're relying on us to do the basic, because I've got a gentleman was swimming, obviously it got shut down, now it's up and running. He can't go because he's not got the type of card. We've spoken to the local community centre, and they've been really, really uncooperative, if I'm honest. We've explained the situation. They know the gentleman. He used to go there regularly every week pre-COVID, and they get to know them, our guys, they know them first names and everything. There is no way they will adapt for us. And I just think it's so unfair that this gentleman can't go back to swimming now. We've asked if we can come in and book on the day and pre-book the next day, because I understand the numbers, but no, it's all got to be done online. It's all got to be done for cards. So this gentleman can't go swimming. And due to his being autistic, it's really causing us issues with him, because he's so used to the routine, but we're having it everywhere.
That's another side to being digitally locked out, isn't it?
Exactly.
Yeah.
And it looks like that's the way life's going now. Everything's online. Everything's you've got to have a card of some sort, and no one's fault of our guys for when it comes to that. It's all right for me as a manager to use my company card, but I can't use it for like 40 odd tenants that I've got. Plus, they want their independence. They want to. This gentleman does do a lot on his own, so he wants to go to the swimming pool and pay for himself, not have to rely on us.
Yeah. I don't have the solutions for you, Wendy.
No,
I absolutely feel your pain and frustration. Absolutely.
And from the look of the chat, it sounds like lots of people are having this problem. So it's maybe worth us having a conversation around that another time. And maybe we can come together and find a bit of a solution, or see what people have come up with. Andy, you've come off mute, and I saw that you were going to ask about taking a screenshot. Was that your only question?
Yeah, I've just to Jane, I found this really useful today. So it'd be great if we could promote and share the toolkit through our networks as well. And it was it was just my normal question. Is it possible to take a screenshot to share on Twitter? Everyone, if people don't want to be, that's absolutely fine. But I was just going to take a quick screenshot if that was all right. Is that okay with people?
Fine.
Maybe if it's not okay, you could knock your camera off quickly.
Yeah. I'm going to do 1, 2, 3. Wonderful, thanks guys. And I'll share that, and I'll hopefully, is the toolkit online that we can share the link?
Yeah.
Brilliant, okay. Thank you.
I'll send the slides out as soon as I can after this. The recording might take a bit longer, but then you've got it to share, Andy. Does anybody else have any questions?
Yeah, okay.
If we have just very quick ones then, because we're 2 minutes past and people might have places to go. So Corinda, one last quick question from you.
I was gonna say, Wendy, you know about AAC, like digital, like they also have I reported it as well. But like I know Kate in the chat, and I know Wendy coming from it. There's a app with on your phone, right? That's the digital AAC one. Will not be any possible thing.
What, so you're saying this app might help people pay for things? Is that what you're telling
Yeah,
me, Corinda?
on the phone.
Okay. So that might be something to look at, Wendy. And Corinda's suggesting, what's it called? AAC? Is that what you said?
Yeah.
AAC digital. Yeah, I need to look at that.
Great, thanks, Corinda. Pat, have you got one last question, or is that an old hand?
Hello, hi, Wendy. It's Patricia Charlesworth here. I have a similar problem, not as severe as that, but there was no reasonable adjustments for me. We're very over time, so I'm going to be as quick as I can. The best thing to do is to write to your local MP and tell them, because those people have a right to reasonable adjustments. Yeah. The residents announcement. Just to let you know that.
Was that it, Pat? Oh, yeah.
Did she get that, Rachel? Do you know?
I think so.
Yeah, that's a really good suggestion.
Yeah, did she get it?
I think so, yeah.
Has she gone already?
No, I can still see her. She just stood up,
yeah.
But she's there.
Yeah. Can she answer herself, please, that she got it?
I think she might be on the phone, Pat. I'll tell you what, I'll send her a message. Is that okay? And then
yeah, that's fine.
Got it. Okay, great. Well then, we will end it there. Thank you very much, everybody, for coming, and thank you, Jane, for sharing the toolkit. I hope it's really useful for everybody, and that we can all connect a bit more around it. Because it sounds like there's some really useful networks and conversations that people can have. So thank you very much. I will send the stuff out later on. And if anyone needs to get in touch about anything, please do.
Yeah. Thank you, Jane, for your session. That was wonderful. Thank you. Are we going to get the presentation though?
Yeah.
Oh, lovely. Thank you. Thank you.